fever is an endemic in Benin, Ghana, Guinea, Liberia, Mali, Nigeria, and Sierra Leone. Nigeria's government brought together top experts from across West Africa to discuss the use of vaccines to combat the disease. According to Nigeria's Health Minister, Ali Pate, Lassa fever has claimed many lives over the past 50 years. This has become a major concern for the Nigerian government. The minister revealed the progress being made in the vaccine development.
The meeting discussed the state of the Lassa fever vaccine development and the progress that is being made in terms of the vaccine development for already one candidate vaccine and potentially a second one and a third one over time. Discussed the approach that we need to take as a region through our task forces, get ready to participate in the scientific endeavor to ensure that the world has a Lassa fever vaccine ultimately, and when available, that we can afford it and we can use it to prevent Lassa fever.
The CEO of Coalition for Epidemic Preparedness Innovations, Richard Hatchett, says it is impossible to tell when the vaccine will be made available since it is still undergoing clinical trials.
Vaccine development doesn't move like a mechanical production process, and you start it and it spits out a product at a specific time. The phase 2 trial that has been initiated last year here in Nigeria is what's called a phase 2A study, and that looks at specifically at the safety and the immune response that the vaccine can elicit. It's not designed to look, it isn't large enough to show that the vaccine protects against actual Lassa fever infection. And so if we started that phase 3 study and then there were some very quiet seasons, it would prolong the time until we have enough cases to know if the vaccine works. So we can't predict a specific date. Ideally, the goal would be by the end of the decade.
On his part, the Director General of the National Center for Disease Control, Jide Idris, says it is important to support research development of vaccines by funding clinical tests and development. The West Africa Health Organization CEO says there is need for funding and concerted efforts within the West African region to fight Lassa fever.
We have a lot of researchers in our institutions. This kind of effort now is supposed to gear them up, stimulate their interest, and with government support again, and stimulate. In research work, we can find answers to not only Lassa fever, to other diseases of interest in this country here.
Our greatest advantage is having the bank's support, along with our economic means and partner organizations. We're also prioritizing health and focusing on disease prevention, particularly for epidemic diseases.
As West Africa continues to work on developing a Lassa fever vaccine, Nigeria and other hotspot countries are advised to adopt preventive measures in combating the disease.
Is to be very aware and to ensure that populations in their households don't leave food uncovered, drinking water exposed, and take steps to ensure these rodents don't live close to human habitations.
Olije, Wapera, Arise News.